Hello everyone. So in this video I am going to discuss the dermatology topic, that is about the nails, and in this video I am going to explain first of all the structure of the nails, and after that we will discuss about the disease of the nails. So and the nails. So first of all we have to know that nails were derived from nails have ectodermal appendages. That nails have ectodermal. So it is ectodermal appendages. So this is the most important point, that nails have ectodermal appendages. And what is the site of the nails? As we all know that nails are on our dorsum side. So it is present on the dorsum side, and in the fingers means in the phalanges, and at the terminal end. So the nails site of the nails were dorsum part, dorsum of terminal phalanges. Now the third point, that what is the function of the nails? So our nails protect our terminal phalanges. So the function of our nail is that it protection to terminal phalanges. Now our fourth point, that what is the surface anatomy? So if we want to know that what is the surface anatomy of our nail, so here I am going to explain by drawing it by myself. So suppose this is our finger, this is our terminal phalanges, on which the nail is present like this, Now in the nail we have here like this, we have half shaped moon structure is there, and here our skin is there, little bit skin is there. So how we can label it? So now for labeling, this is the nail plate, this one is nail plate, and it is a visible rectangular portion, as we see here in this diagram also, that it is a rectangular plate. Now this half moon shaped, this one is known as lunula. Please remember it, that this one is known as lunula, and it is of half moon shaped. Now this thin skin on the nail that is present, that is known as cuticle, and it is thin rim of skin. So it is a thin rim of skin which is attached to the nail, and it basically protect from the air, water and light. So it protect from air, water and light. Now this end is known as the proximal nail fold, and this one is the lateral nail folds. This one is proximal nail fold, and this one is the lateral nail fold. So this is the basic anatomy of our nail. Now we can see in the image also. So here in the image that it is a half moon shape, so it is a lunula, and here is our thin rim of our skin is present, which is known as cuticle, and it is a lateral nail fold, and this is a distal edge of the nail plate. Now in the lateral view, as this one is the lateral view, what we can see, so in the lateral view we can easily see our nail plate, and this one is the distal nail fold is there, and here the nail matrix is present and cuticle is present, and here this is known as aponchia, and here is posterior ligament. There is no need to study about posterior ligament, but we have to know this function, that nail bed is there, nail plate is there, and the area and the part behind below the nail plate, which is known as the hypoonchium. So this part is known as hypoonchium. Okay, so now we also have to know that what is the nail growth rate. So for the nail growth rate, what is the nail growth rate? So we have nails on our fingers and we have nails on our toes. So in the toes the growth rate is 1 mm per month, while for the fingers that is 3 mm per month, Now here the disease, now the next one after the functional and structure of the nails, now the next one is the disease of nails. How many types of disease of nails we know? So for the disease of the nails, the first one is the paraonchia. So for the paraonchia means inflammation is there. So paraonchia is a inflammation of nail folds. So it is a inflammation of nail folds. Now we have two types of inflammation. First one is the acute, means which is taking a little bit slow time, and we have the chronic paraonchia, which like for 3 months continue there is inflammation is going on. That is a chronic part. So in acute parenchyma, the reason is, what is the cause of acute parenchyma? So the most common cause, please remember that the most common cause of acute parenchyma is Staph aureus. So most common is the Staph aureus. Please remember, this point is very important. And in the parenchyma, whenever there is any kind of inflammation, there is accumulation of pus around the nails, and there is swelling and erythema of the nail folds will occur. Now, if the cause is Staph aureus, so for the treatment of acute parenchyma, what we will give the anti-staphylococcus antibiotics, or also we can do the surgical drainage. So these two we can do, whatever prefer. So for the treatment, we can do anti-staph antibiotics, anti-staphylococcus antibiotics, or we can also give the we can also drain it. So surgical drainage also can be done. Now this is the parenchyma, acute parenchyma. This one is the acute parenchyma, in which the most common cause is Staph aureus. Now in the chronic parenchyma, so if someone asks what is the most common cause of chronic parenchyma, so the most common cause of chronic parenchyma is Candida albicans. Please remember it, Candida albicans. So if someone asked most common cause of chronic one, that is Candida albicans, and most common cause of acute one, that is Staph aureus. Now for the in this chronic parenchyma, what will happen, that the inflammation is going prolonged time, like approximate 3 months continuous inflammation is there on. So what will happen, there is fusiform swelling. Fusiform means the nail folds and nail plates fuse together. So the fusiform swelling of nail folds will be there. And if there is inflammation and infection, so particularly this one we find mostly in the wet workers, like like the housewife which use the detergents. So chronic parenchyma, most common cause is Candida albicans. Now the next one, and for what is the treatment, what we give for the treatment of Candida albicans? So for the treatment of chronic one, we have to give the topical steroids for inflammation, or also we can give, like Candida is a fungal, so we can also give the antifungal, like topical antifungal, or we can give systemic antifungal drugs, and systemic antifungal drugs. Now the next one, the first disease completed, that is Oncomycosis, that is paraonchia. Now the second one is the Oncomicosis, where the mycosis represents the fungal one, and there is fungal infection of the nail unit. So if there is fungal infection of the nail unit, now where the fungal infection most commonly occurs, so the most common type of fungal infection is that it involves the distal and lateral subungual oncomycosis. So distal part in the lateral side of the subungual oncomycosis. Subungual oncomycosis. So this is the most common type 1. Please remember, most common type 1 is distal, lateral and subungual oncomycosis. So now we have the other type also, that this one is the first one because it is the most common, while the second one is also there, but which is not the most common type 1, that is proximal means proximal subungual oncomycosis, and which is mostly found in the HIV patient. Please remember, it is most common in the HIV patients. So in the HIV patient, the proximal part will involve, as we can see here, that here is the proximal part, this is the proximal part, and this is the lateral part. So proximal subungual oncomycosis, which is found in the HIV patient. Now the second one, that is the white superficial oncomycosis. Third type is the white superficial means only the upper part is involving, white superficial oncomycosis. So in this, the localization is superficial of the fungus over dorsal surface of the nail plate. So the localization of fungus on dorsal surface of nail plate. So here in the total dystrophic onychomycosis, dystrophic means total destruction will be there. So here the nail plate totally get dystrophied. So that's why it is total dystrophic onychomycosis. Now, if someone wants to ask from you that what is the clinical profile of the onychomycosis, so for the clinical profile of onychomycosis, we have to see that first there is yellow discoloration of the nail plate. So yellow discoloration will be there. Yellow discoloration of nail plate will be there, and the nail plate become the thick one, as we saw in this image that the nail plate is thick. So nail plate becomes the thick one. And the third one, there is subungual hyperkeratosis will be there, as we see the subungual area. So this become the hyperkeratosis. So subungual hyperkeratosis will be there, and this image is a differential diagnosis of the psoriasis. So this image is a differential diagnosis of a psoriasis, but we can differentiate psoriasis from the onychomycosis by seeing the pitting in the nails, because pitting is seen in the psoriasis. Now, what is the treatment of the onychomycosis? So for the treatment of onychomycosis, we have to give the liquor Oncomycosis. We can give the nail liqueurs like amorolfine, and the other one, that is cyclopiroxolamine, which is 8%, and amorolfine is of 5%. Now the treatment of dermatophytic onychomycosis. So for the dermatophytic onychomycosis, we have to give the terbinafine. The drug is terbinafine, which is of 250 milligram OD. And in the fungal, if the dermatophytic onychomycosis is in the fingernails, or if it is in the toenails, in both the doses will be different. Like in the fingernails, we have to give it for the 6 weeks, while for the toenails we have to give it for the 12 weeks. While the other drug, that is the itraconazole, that is an antifungal drug. Itraconazole, the drug is 200 milligram BD for 1 week or 1 month. If it is present in the fingernails, then we have to give 2 pulses, and if it is present in the toenails, then we have to give the 3 pulses. So this is the treatment of the dermatophytic onychomycosis. Now the next one, that is the pitting. So for the pitting, what do we mean by the pitting? So pitting means that there is depression in the nail plate. So there is punctate depression in nail plate. As we see here, these were the depressions in the nail plates. These were the punctate depressions in the nail plates, and it is due to defective nail matrix. When the nail matrix becomes defective, then we can see the pitting is there. And what is the causes of the pitting? So causes for the pitting, like first one, there is the psoriasis. Like in the psoriasis also we can see the pitting in the nails, but in the psoriasis we see the pitting is in the coarse, irregular, deep pits. So coarse, irregular, deep pits will be there. As we see in this image, there is coarse, like the pits were enlarged in size and they were irregular. And the another one, that is causes, first one is the psoriasis, second one is the alopecia areata, in which we can see the geometric pitting. Please remember, in the alopecia areata we see the geometric pitting, while in the psoriasis irregular pits will be there. So in the alopecia, like in this image, as we see, there is regular pits will be there. So it is a geometric pitting. Geometric pitting will be there in the alopecia areata. Please remember it. Now, or in other words, we can say that superficial regular fine pits will be there. Now, the next cause of the pits will be eczema. So these were the causes of the pittings. Now the next one, that is the pterygium. So in the pterygium, what we see, this is a pterygium in which a wing shape flap is there, wing shape fold is there. So in this we see a wing shape fold. So when we see a wing shape fold, that is pterygium, and it is attaches proximally nail fold to nail bed. Or if I have to draw with my hands, then suppose this one is the nails and it is attached proximally it is attached to the nail folds, to the nail bed. So attaches proximal nail fold to nail beds, and here it is a pterygium. Now the another one, that is the Bewes line. And Bewes line, what do we mean by Bewes line? Bewes line is a horizontal depression over the nail plate. As we see, this is a horizontal depression over the nail plate. So Bewes line is a horizontal depression over nail plate. Like here we can see clearly that it is a horizontal depression of the nail plate. Now what is the etiology of the Bewes line? So for the etiology of Bewes line, if there is so many systemic illness, if there is a severe systemic illness will be there. So severe systemic illness will be there, and how we can treat it, or if it is followed by chemotherapy. So following chemotherapy will be there. In that one also we see the Bewes line, or in psoriasis also we can see the Bewes line. So in psoriasis pits will be there and the Bewes line we can see. Now the next one is the chromonychia. Chromo means color, means different color will be there in the nails. So here chromonychia means different colors. We can see the different color of nails, means, or in other words, colored nails will be there. Now first one is the blue lunula. So in blue lunula, as lunula is here, this lunula is blue in color. Now when we see the blue lunula, we can see in the Wilson's disease. In the Wilson's disease, when there is copper deposition is there, in that one we see the blue lunula, and in the ergyria we see the blue lunula, and this is also a blue lunula. Lunula is a half moon shaped part, so this is a blue lunula. Chromonychia. In chromonychia, another color which we see of the nails, that is the yellow nail. So yellow nail syndrome, in other words, so here we see that nails become yellow colored. So it is seen in the primary lymph edema. It is seen in primary lymph edema with chronic respiratory illness. Chronic respiratory illness means like if the person has bronchiectasis, or the pleural effusion is there. Pleural effusion will be there, and we see the yellow nail. Now the other chromonychia, that is green nail syndrome, in which we see the green nails will be there, and when we see green color, then it means there is infection of pseudomonas. So in the pseudomonas infection we see the green nails. Now the another one, that is leukonychia. In leukonychia, leuc means white. So in Blood cells also, leukocytes means white blood cells. So here is leuko means white. So here we can see the white, and inca means nails. So white nails will be there. Now we have different types of leukoinca, that is the two types. First one is the true leukoinca, true one, and the another one is the apparent leukoinca. In apparent, there is defect in the nail bed. Nail bed is defective, while in the true one there is defect in the nail matrix, means nail matrix is defective. Now in the true leukoinca we can see a Mies line. So Mies lines is seen in the true leukoinca. True leukoinca means we see defective nail matrix. So true means defect in the nail matrix, and apparent means defect in the nail bed. So here first we will learn about the true leukoinca. In true leukoinca we see the Mies line, that it is a nail matrix, and we see these Mies lines will be there, and Mies lines is a horizontal transverse white line. So these are the horizontal transverse white lines, horizontal transverse white lines, and it is seen in the chronic arsenic poisoning. Please remember that it is seen in chronic arsenic poisoning. Now the next one, that is apparent leukoinca. In apparent leukoinca we can see the Mycosis bands. In Mycosis band there is paired white transverse band. There is paired one, paired white transverse bands, and it is seen, these bands were seen in the hypoalbuminemia patient. Hypoalbuminemia patient, in which albumin is low in quantity. In those person we see the Mycosis bands. As we see here, these were paired lines, or in this image we can see these were the paired horizontal lines, Mycosis line. Now in the apparent one, the another one is the Lindsay's nail. In Lindsay's nail we can see the half and half nail, means one there is one half nail and another there is one more half nail. So half and half nail will be there, and it is like 50% is pale and 50% is pale in color, and 50% is broken or pink in color. As in this image, this is the half nail and another half nail will be there. So this is Lindsay's nail in the apparent leukoinca. Now the another one, that is Terry's nail. So and one more thing, that Lindsay's nails is found in the chronic renal failure patient. In chronic renal failure patient we see the Lindsay's nails. Now the Terry's nail. So Terry's nail, it is seen in the cirrhosis patient. Please remember, it is seen in the cirrhosis patient and in chronic liver disease. Cirrhosis is a chronic liver disease. In cirrhosis we see the Terry's nails. In Terry's nails we have to understand that in the Terry's nails there is 90% nail is white in color. 90% nail is white in color, but the distal 1 to 2 mm part of the nail is pink or brown in color. As we see that this nail is 90% is, this nail is 90% white in color, while the last distal 1 to 2 mm is pink or brown in color. This is the Terry's nail. So that's all for the dermatology, that is the nail and disease of the nails.